The Department of Human and Health Services reported that 100 million surgeries were performed in the United States in 2010. That means there's a lot of people out there with scars. And that was just in 2010. Some people don't like the way their scar looks. Some might experience pain at the incision area. Some don't notice anything at all. Surgeries have become so common these days that most people think it's just a simple procedure. I'll be discharged tomorrow. What's the big deal? Well, you might not think it's a big deal, but your body does. Not only was it cut into with a knife, but it's left with permanent damage to the tissue. What you might not know is, if you don't regularly take care of your scar, like taking care of your teeth, brushing them, and going to the dentist, if you don't take care of your scar, it will eventually cause other problems. You're probably wondering, how can my scar cause other problems? Well, let me explain. If you had a hole in your pants and you wanted to sew it up, you'd have to pull the fabric tight, right? That's the only way you can sew the hole together. Well, same thing with you. To close the incision area, your tissue, your skin, and all the fibers around it have to be pulled tight. That doesn't sound too comfortable. If you pull my skin tight, that kind of hurts. Well, now it's going to start pulling on your structure. If I have an incision in my stomach, maybe I might not look like this, but my body's going to start pulling this way. Here's where the problem comes in. As my body starts to pull into this direction, my brain becomes very unhappy. You see, the brain is the captain of our ship. Our captain likes to see on the horizon at all times. When it can't see straight, it will do what it can to pull the body back into place so it can be level. It doesn't care about how your body feels as long as it's happy and seeing straight. To do this, the brain uses two muscles, controlled by your 11th cranial nerve or the spinal accessory nerve. This nerve controls the trapezius, which is this huge muscle that goes from the top of your neck out to your shoulders and most of the way down your back. And as most people know, your whiplash muscle, or sternocleidomastoid, SCM. These two muscles are responsible for keeping the brain straight. It will tug and pull on your body so that the brain is happy and level. So, I have an incision in my stomach. I'm now pulled a little bit this way. My big trapezius muscle in my SCM tug and pull me back this way. Alright, I can already see maybe I'm getting some headaches here, or shoulder pain that's nowhere near my scar area. At first, your scar may have some color to it. That's because the body is trying to heal it, and it's bringing blood and circulation to the area. But over time, your scar turns white. Your scar turns white because after the body realizes it can't heal it anymore, it blocks off that area so no blood or circulation is getting to it anymore. Not only does it block the area off, but it traps some of that healing inflammation in there, which will eventually become what we call chronic inflammation, and it's stuck in an area that your body doesn't want to get to anymore. So, now you have a scar that is tight, it's white, it has no elasticity, it's tugging and pulling. Your 11th nerve and your muscles are pulling your body in the other direction. You're this way, you have some pain, and now you have some pressure possibly on that area from the trapped inflammation. This pressure could be obstructing some of your internal. So now what? How do I take care of my scar? There are several therapies that you can do. Neural therapy and prolotherapy use injections to bring circulation and soften the scar. Acupuncture, which is what I'm licensed to do, we can use needles and moxibustion to also bring circulation and open up the obstructed areas. We can also use our acupuncture to reduce some of the inflammation and some of the other signs and symptoms or ailments that you're having. If none of these practitioners are near you, or you can't afford that, there are some massage therapists that do scar treatments. If you can't afford any of this, or nothing is nearby you at all, you can do some things yourself, like coconut oil or olive oil. Vitamin E is great too. You can rub these on your scar daily. Use a little heat. It'll open up the pores so that the oil can get in and soften up the tissue. If none of these practitioners are near you, or you can't afford that, there are some massage therapists that do scar treatments. If you can't afford any of this or nothing is nearby you at all, you can do some things yourself, like coconut oil or olive oil. Vitamin E is great too. You can rub these on your scar daily. Use a little heat. It'll open up the pores so that the oil can get in and soften up the tissue. Regular care of your scars is very important, so you don't get chronic conditions down the line. For more information on scars, you can go to thebigelsonmethod.com and read my article, and look for future YouTube videos on specific treatments.